Director for Population Sciences and Community Outreach at the Ohio State University.
And do you mind spelling your first name for us, please?
Sure. Electra. E-L-E-C-T-R-A.
Thank you.
I'm Anna Giuliano, and I'm also a professor in the Department of Cancer Epidemiology, and I'm the founding director of the Center for Infection Research in Cancer at the Moffitt Cancer Center in sunny Tampa, Florida.
And can you say and spell both your first and last name?
First name, A-N-N-A, last name, G-I-U-L-I-A-N-O.
Thank you.
Hi, and I'm Debbie Saslow. I am the Senior Director for HPV and Women's Cancers at the American Cancer Society, and I lead our HPV work there, and the spelling is D-E-B-B-I-E-S-A-S-L-O-W.
Thank you.
Tamika Felder, T-A-M-I-K-A, F as in Frank, E-L-D-E-R, 17-year cervical cancer survivor, founder of Survivor, C-E-R-V-I-V-O-R.
Deanna Kepka. I'm an assistant professor in the College of Nursing at the University of Utah. I'm also a member and investigator at Huntsman Cancer Institute. I'm the director and founder of the Intermountain West HPV Vaccination Coalition. My name is spelled D-E-A-N-N-A-K-E-P-K-A.
Wonderful. Well, thank you all. So just to get started, Dr. Kepka, will you give us an overview of why everyone is here today at Huntsman Cancer Institute?
So today is the first day of our 5th HPV vaccination meeting that is held with a consortium of HPV cancer centers, NCI cancer centers in the United States. So it may be the 5th meeting, but it is the first meeting in Western United States. And it's our first meeting here at Huntsman Cancer Institute. And we are so excited that we're hosting participants from more than 35 states. We have 220 individuals registered, coming from more than 25 NCI cancer centers. And so we want to bring awareness about HPV vaccination to the Mountain West, where, in my opinion, we've been a little bit neglected, and we've got some of the lowest rates of HPV vaccination in the United States. We have our work cut out for us here.
Why do you think that is, that there's a low rate?
I think we need to just do better at integrating this vaccine into everyday primary care. We need strong provider recommendations. We need to normalize this vaccine with other adolescent immunizations that we're so great at delivering here in Utah and other nearby states.
Do you think it has anything to do with religion or culture, or what do you think it is beyond that?
I think there's been a little bit of a delay to integrate it because there's been some discomfort around recommending it. But I think we have plenty of providers who are leading this initiative and are willing to do better and are willing to train other providers to make that strong recommendation, to make that announcement.
Do you think, though, it has something to do with getting the vaccine and having the discussion with your child about being sexually active?
I think we do have some data that show that among adults who are, we've looked at survey data, who state that they're more religious, they are less knowledgeable about the vaccine. So that tells me that they've been less informed, and we don't really know why. They've just been less informed. So my opinion is that we just need to make this strong recommendation and just separate it. It really shouldn't be a sexual health topic at ages 11 and 12. It should be a cancer prevention recommendation, a strong cancer preventive medicine recommendation for 11 and 12-year-olds.
And Dr. Pascal?
Yeah, I'd like to chime in on this. I work in Ohio Appalachia, which also has very strong religious beliefs and social norms, and so I can add some more information about the question that you asked. So when HPV vaccine was introduced, there were some very erroneous myths that surrounded it, that it was going to allow people to be promiscuous and things like that, and that is totally wrong. And if we can get one piece of information out during this conference, it is that the HPV vaccination is for cancer prevention, has nothing to do with allowing people or teens to engage in sex. Absolutely wrong. We're talking about preventing a cancer. And that is the main message that needs to get out. You know, we vaccinate our children for other sexually transmitted diseases like hepatitis B, and nobody ever brings up the fact of promiscuity. This is all about cancer prevention. You know, my mother was a cervical cancer survivor, and I'm a breast cancer survivor. And, you know, if there was a vaccine for breast cancer, people would be lined up around the corner. And we need to do the same thing for the HPV vaccine, because it can prevent up to 6 types of cancers. And we really need to do that and be responsible and reduce these cancers in this country and in the world.
Yeah. And Dr. Giuliano, maybe you can walk us through, you know, a little bit about the HPV vaccine. We're getting some
Sure.
comments on our Facebook page, you know. Can we talk a little bit about what the vaccine is, who should be getting vaccinated,
Sure.
and then some of the maybe potential risks or even benefits about that?
Right, so before we talk about the specifics of the vaccine alone, as you heard Electra say, there are up to 6 cancers that this vaccine can prevent. So I want you to pause on that one.
Incredible.
Up to 6 cancers that can disappear if we actually follow through with the opportunity that we have, which is to vaccinate both males and females. So we heard a very compelling story about cervical cancer, and we are closest to eliminating cervical cancer because we have 2 strategies. We have vaccine and we have screening. But not too far behind that is the opportunity to prevent the other 5 cancers that affect both men and women. And by the way, those other cancers, we don't have anything we can offer people for prevention. There is no screening. The only opportunity we have is vaccination. And so I want everyone to understand, imagine saying that we can get to 0 for a cancer. Have you ever heard someone say that? Getting to 0 for a cancer, getting to 0 for multiple cancers. That is what the United States is close to achieving, if, only if, we can actually follow through and utilize the tools that we have. Now the vaccine, why is it so wonderful? It's phenomenal. So if you compare it to the other vaccines that we deliver to children, it actually has a much higher effectiveness. It's also probably among the safest vaccines. So when people think about vaccines, they tend to think about either a live, you know, so you're taking a part of the actual virus, and you're sort of diluting it out, which is of concern, I understand, because there's always that little chance of infection, or you're totally killing it. Okay, in this case, we're not doing either. What we're doing is taking a part of the virus that is non-infectious, but that part of the virus that's non-infectious is what creates a really strong antibody response. So there's no risk of infection whatsoever. This vaccine has been given to tens of millions of individuals around the world. It has been evaluated up and down, sideways, in every way you can imagine. And the bottom line is this is a safe vaccine. The benefits far outweigh any of the side effects. What are the side effects? Because people need to be aware of it. You know, my son was probably the first 12-year-old boy vaccinated. As soon as we got licensure, I'm like, we're getting vaccinated. And I said, now, let me tell you, Erin, the girls are complaining that this vaccine hurts. I want you to be prepared that you're going to say, Mom, you made me take a vaccine and it really hurt. And I said, now let me warn you something else. If you stand up really quickly after getting that vaccine, you may faint, because that happens. You're not supposed to stand up quickly after getting any vaccine.
Sure.
So he sat there and he was like gripping the chair, got the vaccine. He said, Mom, that wasn't bad at all. So, you know, everything's relative. What are those side effects? Pain on injection site, not listening to your provider and standing up right away, maybe having a little spill.
Yeah. And, you know, Debbie, can you walk us through who should be getting this vaccine? What is the actual recommendation, you know, from the CDC and from these cancer centers?
Every boy and girl in this country, hopefully around the world, but every boy and every girl at age 11 to 12 should get this vaccine and come back 6 to 12 months later and get the second dose. They will likely be protected for life. They will be protected for at least 12 years. There is no indication that the immunity is going to wear off, but we are monitoring for that. Every boy and every girl, with very few exceptions, such as if there's a known allergy to an ingredient in the vaccine. And so, wow, 2 shots and you can prevent 6 cancers. It doesn't get easier than that.
So let me just extrapolate a little bit more on the age for the vaccine. That is absolutely correct. That is the target age. That is the CDC's target age, 11 to 12-year-olds, because of a couple of reasons. First of all, they're coming in for their other 2 shots, the meningococcal and the Tdap at that time. Second of all, the research has demonstrated that the young age, they're actually able to mount a bigger immune response to the virus that Dr. Giuliano talked about giving. And what the virus does is it gets our soldiers, who are our immune system, to start to fight anytime we are all infected with HPV. And for those of you who think, well, I'm not going to get it, my child is not going to get it, up to 80% of sexually active adults have been infected with some type of HPV in their entire lifetime. 80%. I'm not willing to risk that for my children. All 3 of my boys have been vaccinated. So the age actually is from 9 up through 25. Okay. Some of the pediatricians in my area actually have found that it's easier to give the shots under 11, that the parents are more accepting of the shot for their 9-year-old, and it is recommended at that age. Anybody under 15 only needs the 2 shots, as Debbie said, 6 months apart. But we have this catch-up where people can get the shot, but they need 3 shots up until age 26. So it's really important to know the difference in the number of shots and the complete age range.
What about adults, people in their 40s and 50s that are just hearing about this? Should they get a vaccine or not?
Yeah, so that's a great question. A question that I often hear is, where did 26 come from? Where did 25 come from? Where did 21 come from? So in the United States, the vaccine was licensed by the Food and Drug Administration up to age 26. Okay. By the way, in Europe, the regulatory agency said, we're not putting an upper age limit on this. The vaccine is licensed with no upper age limit in Europe. Now, 2 things to understand. Just because it's licensed or with no upper age limit doesn't mean that there's a policy to vaccinate in that age group, okay? So we need to be careful to distinguish that. But there is some interest, especially for men, who never really develop a natural antibody once they're infected, and it really looks like they remain at risk for the infection throughout their life in ways that are different than women. And if you look at the cancers that men get from HPV, it is happening at an older age. So, Tamika, you mentioned oropharyngeal cancer. The average age of oropharyngeal cancer diagnosis is 15 years older than cervical cancer. This is a cancer that is increasing in incidence in men, not in women, and in white men. And one of the issues is, what can we do for these men who are past the vaccination age? So there's research interest right now. It's only in the research setting and testing whether the vaccine is safe, whether it will have efficacy. And that is the topic of intense research right now. It's a great question. A lot of people want an answer to it, and hopefully we'll be able to deliver that answer in the next 5 to 6 years.
And in the meantime, for women, they need to get their cervical cancer screening.
Yeah.
And does the vaccine help someone who may already be infected with HPV?
So the vaccine has 9 types of HPV that it protects against, 7 of which cause cancer. If somebody has one type of HPV, the vaccine will not protect against that. It's not therapeutic, but it will protect against those types of HPV that the person has not already been exposed to. And so while most people have been exposed to at least one type, very few have been exposed to 4, 5, 6.
In the clinical trials that included tens of thousands of women and men, there were no individuals that were positive for all 9 types at the same time. So that tells you that everyone can benefit to some level by receiving vaccine.
And so did you say that we don't know yet if it's beneficial to men or women over the age of 25? I mean, women that are seeing this today and they're like, wait, I'm just hearing about the vaccine. Should I get one or not? I wasn't quite clear if.
So there have been trials in mid-adult age females, and there is a benefit for women who enter the trial negative for the vaccine types.
Yeah.
This is what we were talking about. Those trials have never been conducted in men. And the reason there's intense interest in mid-adult age men is the cancer that is increasing at a very fast rate in the United States, 2% increase per year in the incidence, is oropharyngeal cancer in men. And we have nothing we can offer men at this point. And that's why there's very strong interest in testing the vaccine in that mid-adult age range to prevent those cancers. We don't have the answer yet.
And if someone has one of these questions, who would you advise that they speak with?
My suggestion is always that they speak with their provider. That's a conversation that a patient should have with their provider who understands who they are medically, where they can have a conversation about what the perceived risk is and the perceived benefit.
So I also want to mention that ACS has some wonderful materials, and they just are launching a new campaign. Maybe Debbie can talk a little bit about that. And then the CDC has wonderful materials for the public, whether it's a patient or a teen. Wonderful information. Debbie, I don't know if you want to talk about your campaign.
Is that
Sure,
okay?
absolutely.
So this week, the American Cancer Society launched a nationwide and soon-to-be global public health campaign called Mission HPV Cancer Free. And our focus is on the on-time vaccination, the recommended age of 11 to 12, starting as young as 9. But yes, the vaccine is available and licensed currently through age 26. And so we are launching a new marketing campaign. We are launching a new website, www.cancer.org/HPV. There are some very well-received and very short handouts for parents, for providers, talking about the facts, talking about the messages, great videos on what to do when a friend of yours expresses a concern or has a question. It doesn't mean they don't want the vaccine. It just means they have a question about it. And so we're really hoping to take what has been done from so many organizations, the CDC, the American Cancer Society, the cancer centers, the pediatrics groups and the family practitioners. There are so many groups that have been focused on trying to get the rates of HPV vaccination up because we have a vaccine that's going to prevent 6 types of cancers that people aren't using. And we're trying, along with the cancer centers this week in Utah, to just up that level. And can we get it from over 50% all the way up to 80%,
Sure.
which is where the other vaccines are. So these kids are in doctors' offices getting other vaccines.
So I think we have 2 more questions. But Dr.
I
Juliana, if you
think,
want to say
yeah,
something.
so, Debbie just said something, in addition to the message of HPV vaccination, that's really crucial, that is happening here today and tomorrow, which is the team. You just heard her mention the American Cancer Society is doing a phenomenal job launching a very serious global campaign, major focus in the United States. But to really get this to work, everyone has to be part of that team, and that's that team of champions. And I feel really privileged that our group of National Cancer Institute designated cancer centers are joining in that statement. And not just us. We actually found that the big cancer organizations said, well, we want to come in on it too. Can we be part of it? And so what you're seeing is this growth of a team that really I think can make it happen for this country. The message is we have the tools to eliminate these cancers, period. Let's just do it.
And as patient advocates, we want to make sure that we complement all of that work, because a part of the problem that I saw is that patients were stepping up, sharing those real life stories to say, hey, this is what happens, if you have an HPV related cancer. And so I just think we're in an incredible time right now to do just so much good.
Wonderful. And one of the last questions that we had on our Facebook channel, I just want to make sure that we're also, fulfilling those questions. But Dr. Kepka, if you just want to walk us through the different types of cancer that is prevented from the vaccination, not just cervical, but the others as well.
So as we mentioned, oropharyngeal cancer.
And can you define what area of the body that is?
The back of the throat, the oropharyngeal region. So it's largely caused by HPV type 16 and 18. Anal cancer, penile cancer, vaginal cancer. What else am I forgetting? Vulvar cancer. Cervical, of course,
Those are
cervical.
six.
Yeah.
And one last time, we're getting a lot of comments about the safety of the vaccine. I wonder if you could just comment one more time on how safe it has been proven to be.
Tens of millions of doses delivered.
Hundreds of millions.
Hundreds now. Sorry, hundreds.
There's so many doses we can't even keep up with
No,
them.
actually, what I should say is how many doses?
300
It's
million
300.
worldwide.
Yeah, and what's the safety profile?
It's equivalent to that.
Awesome.
It's equivalent. The safety profile is equivalent to that of the other childhood vaccinations. And this week at the American Society of Clinical Oncology, Doug Lowy, who was one of the co-inventors of the HPV vaccine, received an award, and he gave an update on the safety profile, and that has not changed. And it's been 12 years since the first vaccine was licensed, so it is safe.
And it has been studied more than any other vaccine, so we're even more confident in the safety.
And we have people, we need to make sure that they get their information from credible sources.
Right.
Social media is a great thing because it brings us all together. We get instant information, but it's also a bad thing because of that, and anyone can be a publisher. And so we just have to make sure that as you're doing it, have a conversation with your provider. That's key. And then if you go to Dr. Google, make sure that they're credible sources that you're looking at.
We have to remember 1 in 20 cancers diagnosed are caused by HPV. I want you to think about that. That's a lot of cancer you can avoid with a very safe vaccine.
Wonderful. Well, thank you all so much.
Thank you.
We look forward, obviously, to the work that's coming out of this meeting, and the opportunity to continue the collaboration not only between the cancer centers and American Cancer Society and patient advocates and all the other organizations that have come together.
Thanks.
Thank you.
Thank you.